When a child is stung by a bee, there's always some form of reaction. And for various children that can be mild, where they just get a little bit of swelling around the bee sting. For some children, they have a severe allergic reaction, even what's called an anaphylactic reaction. And so it depends on how severe it is. Most bee stings are fairly mild and will heal within a few days. Cold compresses help with the swelling and the pain. Acetaminophen is good for children to use if it's tender or painful. Reasons to be worried, and if you're looking for an anaphylactic reaction, they may have some swelling of the throat, which isn't always obvious. Sometimes kids just cough a lot, and if that's somewhat abnormal for them, you may consider whether or not they're having a reaction to it. Or if they obviously have swelling that you can see, if they're having trouble breathing, then you need to get them into the emergency room so that they can administer some medication to open up those airways again, get them breathing. But for the most part, bee stings are pretty mild. If they have an anaphylactic reaction, a lot of times they'll know, and they may even have an EpiPen. So that's an epinephrine injection. And if they have one of those, then you could administer that, and that would be a good option to help release some epinephrine into the system, which will help relax those airways and open up the airways again. If they don't have that, then you really want to just kind of support them as much as you can. If you have some Benadryl or something, that's not a bad idea. But sometimes it's hard for them to swallow anything if they're really having swelling in the throat. So it can be kind of difficult, but as long as they're getting to the emergency room, that's the best and the most important thing.